Hi, I'm Dr. David Tenner, and we're here at the Goldberg Clinic for chronic disease reversal. And today we have Christina Jones with us. She's here with her mom. And Christina is going to share her story with you, our audience. So Christina, tell us a little bit about what brought you in initially and the kind of concerns you were having with regards to your health.
Okay, so initially I started getting sick. I had a cold for maybe about 2 weeks. Right after that, I got arthritis in my hands, which was very, very painful. Slowly I started getting rashes, I started getting headaches, and it just started progressing worse and worse. I went to a rheumatologist and she said that she thought that it would be lupus, just like I was told by another doctor. And so immediately I came to Dr. Goldberg and Dr. Tanner, which my mom found, and we started getting healthy, changing my diet, and just trying to make this lupus go away.
Okay. Now, Mom, when Christina was having these kinds of issues, you had brought her to the rheumatologist, and what had they recommended for her?
She was told that if she continued to have the symptoms, that she would be on medication the rest of her life.
Medication is the rest of her life?
Yes.
What kind of drugs were they recommending for her?
Plaquenil?
Plaquenil.
Yes.
Okay. Christina's story is a very common scenario with patients with these kinds of problems. They start manifesting some joint pain, they have some rashes and other autoimmune type issues. They say a rheumatologist, and then immediately they're stamped with a particular disease or disorder. In your case, they were telling you you had lupus.
Right.
So the problem with diagnoses and with labels is that they don't tell us what's actually causing the problem. Really all they are a label for the symptoms that you're having. And then once you're stamped with that disease or that diagnosis, out come the drugs, which don't work to address what's actually causing the problem. Now, Christina, unlike most of our patients, had not gone down the medical path at that point. Instead, she came to work with us. And rather than label her and stamp her and give her a bunch of things to take, we said, what is it about Christina? What is it that she's doing that's causing this problem to occur? And let's address those factors directly. And so we did a case history. We got to know you, spent about an hour and a half with you at your initial visit, a thorough physical exam, and then we did some lab work to better hone in on certain areas that were problematic. And then we developed a specific individualized program for Christina to follow, and she came back in May, and today is September 8th, 2014, so it's been about 5 months. And what have been the changes that you've noticed so far?
Definitely with the test that we took, what was the clear and the black?
We ran an indican test on Christina, which is a measure of how well she's digesting her food.
Right, and at first it was black, and then we got to the point where it actually came out clear, which was completely different.
So your digestion improved quite a bit.
Yes,
Okay.
and which was the main problem, because lupus has to do with your digestive system.
Right. And Christine is referring to the fact that over 75% of the immune cells are actually located in the gut. So improving digestive function is always important in helping to resolve autoimmune issues.
Right.
What's changed in terms of your symptoms? How are you feeling differently at this point?
I just feel a lot healthier, a lot more energetic than I was at first. I would lag a lot, or just be tired, and I had these headaches, and they've gone away, and all my symptoms haven't come back since we
Okay, so
started.
your joint pain's gone,
Right?
your headaches are gone,
Yes.
your energy's better,
Yes.
and your skin is cleared up.
Yes.
Okay.
All of
Pretty
those
good, all right.
things.
Well, we're very happy with that.
Yeah.
Christina's done very well. She's been an excellent patient because she has worked hard with us, which is important. We can only give Christina the right advice and the right recommendations to take. She's the one that actually has to go home and do the hard work, which, Mom, has Christina been doing the hard work with us?
She has been doing the hard work.
She's been
very
consistent.
proud of her.
Okay. Well, it's real important that we keep Christina healthy now and keep her doing the right things, because she is going to be a star in musical theater. In fact, she's performed quite a bit over at the Fox Theater. What plays have you been in? What shows?
Annie, The Wizard of Oz, Joseph and the Amazing Technicolor Dreamcoat, Casper the Friendly Ghost. I've been in Huckberry Finn, a couple others.
All right, well, all the more reason now to keep you healthy so that you can get back on stage and perform and be the star that I think we all think you're destined to be.
Yes.
So thank you for sharing your story with us today. We hope it will serve as an inspiration to others who are suffering with similar issues and are at a crossroads in terms of the kind of things that they want to do to get themselves well. We think our approach gives patients the best opportunity with these kinds of issues to resolve their health, and not just resolve their health temporarily, but for the long term, so that they go on and live healthful lives, and then, as Dr. Goldberg would say, start to take care of themselves. So we've been teaching Christina the right things to do to now keep yourself healthy. All right, Christina, thank you very much.
All right,
Thank you for joining us, and we'll see her on stage probably. All right, thank you.